very much, Senator Grassley. I'll now turn to Senator Wyden and then introduce the panel.
Thank you very much, Madam Chair, and thank you for all your leadership. I don't believe anybody in public life has prosecuted this fight against drugs the way you have, Madam Chair. Not just meth, but generally the fight against drugs. So I'm very, very appreciative of all the time that you've given me on this issue and your leadership, both in passing the federal legislation and on a host of other anti-drug efforts. And as far as the gracious comments of my friend Senator Grassley, I'm of the view that Senator Feinstein and Senator Grassley give bipartisanship a good name, and frankly, the two of you ought to be put in a copier or something and get some more people in Washington, D.C. to pick up on the Feinstein-Grassley example. And I want to thank Senator Grassley for all the time that he's given me as we've discussed this issue. Chairwoman Feinstein, you've made so many of the important arguments so well. Let me just try to highlight a few of the key issues and try to set the record straight with respect to some of the particulars about this issue. When Oregon debated going to the approach we put in place, a prescription for pseudoephedrine, at the Oregon legislature, opponents of the bill advanced what amounted to a parade of horribles. The state legislators were told that just about everything awful in Western civilization would descend on Oregon if we passed this law. We were told that prices would go up. We were told people wouldn't be able to get their medicine. We were told people would be subjected to god-awful inconveniences of every size, shape, and form, and none of it has happened. And let me put on the record an example that I think would be relevant for folks in Iowa. Senator Grassley has long had town hall meetings in every county every year in the state of Iowa. He's got a lot more counties than I do, but I've got a lot of counties too. And since the passage of this law, there has not been one single complaint at my town hall meetings about this law. I've consulted with state legislators as well. They have not had the complaints either. So as we listen to this debate, and I think it's important to do exactly what Senator Grassley said, which is to get into the specifics and how folks are affected, I want to set on the record that every one of these horrendous consequences that we are told will affect people in all parts of the country if the nation goes to a Oregon-type approach to meth. Every one of those arguments was advanced in my home state in great detail, and we have not seen the problems. And part of this is just getting the story out. The pictures that Senator Grassley showed apparently are from an article that was written shortly after the law was passed. So the evidence, for example, as presented by Oregon law enforcement officials is now very different. For example, since the law has been enacted, we have gone to a significant reduction in the number of meth labs. In 2009, Oklahoma had 743 meth labs. Kentucky had 741. Arkansas had 643. Oregon had 10. Now, with respect to law enforcement, the mention was made in connection with that article. There's a relevant point as well. When I announced that I was going to work with colleagues on a bipartisan basis in Washington, D.C. to take the Oregon model nationwide, when I made that announcement, law enforcement officials from across the state lined up to say, we need this legislation, we are going to be behind you. So any suggestion that Oregon law enforcement is not overwhelmingly behind this approach, taking the Oregon model nationwide, is simply not accurate. I see my friend John Kroger, Oregon's terrific Attorney General, in the audience. He will be laying out the case for why he and law enforcement officials in our state are overwhelmingly in favor of this approach. A couple of other points, and then I think we ought to move on. First, Oregon has tried the kinds of approaches that other states are still testing. For example, legislators in Oregon said, well, let's look at putting PSE behind the counter, requiring the log books, limiting the purchase to, in effect, try to test that kind of system. What happened when that was tried is a group of Oregon legislators went out and did their own smurfing operation as an experiment, and they themselves found that it wasn't working. Under that kind of approach, they could go out and buy enough PSE to cook a bunch of meth, and certainly with the phony IDs that our chair has advanced, you see further evidence of it. One last point, if I might, Madam Chair. In 2009, the crime rate in Oregon dropped by 10.6%. I've been one to say that it is never possible to attribute a drop in crime to just one factor alone, but the Oregon Criminal Justice Commission pointed to our law requiring that PSE be by prescription, that was a major factor in the decrease that we have seen. So I look forward to our testimony and our witnesses. And again, I urge legislators and those who are following this debate to look at the arguments made by the opponents that the policy will hurt legitimate consumers, people will experience higher costs, doctors will be overwhelmed by appointments, pharmacists will be in revolt. I ask, show us the evidence. I don't believe you can put the evidence on the record. We would all agree the scourge of meth is not a partisan question. When you visit these homes that practically look like Superfund sites, nobody is going to ask, is this a home that has a Democrat or a Republican in it? They want to see what's going to be done to control this horrendous scourge. I look forward to working with my colleagues, our chair, and Senator Grassley to look at all of the possible tools to deal with this public health and public safety menace. And I thank, again, our chair for scheduling this important hearing.
And I thank you, Senator Wyden, for those very cogent and strong comments. They are appreciated. I'd now